So here at Salus Plastic Surgery, our motto is it's all about the details. What I do is basically make people happy. That's my job.
The relationship between me and my patients is based on trust.
Hey everyone, it's Dr. Salus from Salus Plastic Surgery. We're doing a series of videos which are Q&A videos. It's based on questions that patients ask often that we feel will be helpful for you guys to know. Today's session is the tummy tuck Q&A. We named this one the Scar Edition. It's 5 questions that I think are relevant to scars and scarring with tummy tucks. So let's get started. Number 1, will it remove all my stretch marks? Well, a tummy tuck is designed to remove a lot of stretch marks. All of the stretch marks kind of depends on your anatomy. So the incision, as you know, goes very low down below your painting line, and that allows us to really lift that skin up and pull as far down as we can. Whatever we can get out, we will during the surgery. The key is where your stretch marks sit. If they are above the belly button, you will probably still have those left, but they would be moved way down low, hopefully below your bikini as well. Okay? Number 2, will it remove my C-section scar? Well, almost 100% of the time, yes. Barring any incredibly low C-section scar, I will take it out with mine. I tend to do my incisions really low, again, to try and keep them below any bikini or bathing suit or underwear or anything that you might wear so that you can hide it. That usually goes below somebody else's C-section scar and completely removes it with the segment of skin that goes away. Number 3, is there anything I can do to help my scar heal? Yes, absolutely. A lot of the scar healing depends on how you take care of it. As you guys know, when I do my incisions, they look like somebody drew them with a pen. That's the goal. That's me as a plastic surgeon trying to give you, as a patient, the nicest result I can give you. And when I'm done, and it looks amazing, that's it. I pass the torch on to you and I ask you to take care of it for us, right? So what you can do to do that is obviously eating and drinking, which gives your body the resources necessary for healing, right? Taking care of the scar, which means don't rough it up, don't overstretch it and twist and turn and tug on it. That will cause, irritation and abrasion on that scar. And then scar creams such as Silicone silicone scar cream, which is the one that we prefer. There are other versions of silicone scar creams that will be helpful, but silicone really is one of the few things that has been shown to improve your healing of that incision. So those are some good options there. Number 4, how will the scar look like after a couple months? Really, that depends on all the things we just mentioned in the previous question, and how you participate. And then there is some element of how your body heals in and of itself. So some people heal very nicely, some people don't heal as well. However, if you do all the things we mentioned, you give yourself the best shot of having the nicest scar for your body. And then number 5, should I lose weight before my procedure? This all ties in with taking care of yourself, right? And helping us give you the best result possible. I don't always recommend losing weight before your procedure. I do recommend you trying to be as safe as possible. And if your BMI, your body mass index, is on the higher side, we do ask you to bring it down a little bit lower for 2 reasons. 1, safety, right? Because some studies have shown that your risk of complications does increase as your BMI goes up past a certain point, and then is more normal if it's below that, right? We would like to be in the lowest chance of problems with your surgery. We want you to just have the good stuff, not any of the bad stuff. And secondarily, it is beneficial for your ultimate result. The more weight you lose, the easier and the more skin I can remove and more tissue I can remove, and the nicer the result and contour it can be. So that's why I ask you to help me help you get that nicest result by getting us that weight down. Now, there's a little caveat to that. I don't want you to go super extreme and lose the most weight you've ever lost and be the skinniest you've ever been in your life, because if you're not able to maintain that level, it's gonna change if you bounce back too far after surgery. I'm going to do the best possible surgery I can do on you on the day of your surgery. And so whatever you weigh that day, that's what we will focus on, making you look amazing at that weight. So you can fluctuate a little bit up or down, but we don't want you to go 20 pounds up or 20 pounds down, because that may change how the result looks. Okay? So there you go. 5 questions that hopefully will be helpful for you in terms of your tummy tuck journey. Stay tuned, we'll be doing a lot more of these. We'll see you soon. Bye.